Right before the break, we brought you a story about how many people get embarrassed to ask certain questions at their doctor's appointment. They don't either, they're fearful, they don't want to know the answer, or they're almost afraid of being judged by their doctor. Well, doctors say, hey, we've seen it all and we can help you be more open with us. And joining me now to talk about that is Dr. Lori Mouzy. She's an OBGYN with Corewell Health Beaumont and Royal Oak. Dr. Mouzy, it's good to see you.
It's good to be here. Thank you for having me.
I love this story because I think sometimes we get fearful when we sit in with our doctors. We just want to make sure that everything is okay, and revealing information can be really difficult.
It can be very difficult. I mean, the reality of it is I have about 20 minutes to try to make a patient feel comfortable with me, especially a new patient who I haven't met before. To help them feel comfortable in divulging their health care to me. And it's not a lot of time. So I have to make sure that I can come in and be personable and compassionate and just try to make a patient feel at ease.
Are there any specific tips or things like that that you talk about with other doctors about, all right, I usually try to do this, this, and this, direct eye contact, or what are some of the things that you do to make sure that people feel that they can reveal? And especially as an OBGYN, you need to know everything.
There are a lot of taboo topics out there in OBGYN. So I do have to try to get to patients' concerns. So even, as early as medical school, we are taught to ask open-ended questions. So that's what I try to do in the beginning, is ask open-ended questions. When I first meet you after the introductions, is there anything that you are coming to me for that is a concern for you? And let them just talk in the beginning and not just bombard them with a whole lot of questions in the beginning. And then I can kind of narrow those questions down and get more specific with their health care as the interview goes on. But I really try to give them an opportunity to talk in the beginning, just so they can feel comfortable and know that I'm listening, and I'm not trying to rush them through the appointment.
I think that is such a key thing, that you're not trying to rush them. And of course, time is always limited. I think sometimes that people also feel that they will be judged. I don't think that we can hear it enough from doctors saying, hey, I've seen it all. I've been trained in this. I am your conduit to good health. Tell me it's okay. You're not going to be judged.
I am an advocate for women's health care. That is what my field is. That is what I do. So I'm their advocate. I want to be an advocate for them. And the only way that I can do that is if I know as much as I can about their history and what's going on in their lives. And they shouldn't feel judged. I ask everybody, you can be married, and I'll ask you if you would like to have sexually transmitted infection testing. It's not because I'm judging. It's not because I am, trying to delve into your history. I just want to know. And some women are like, sure, do it. I've never had somebody ask me that before. So it's not that I am trying to be judgmental. I just want to know. I just want to be there to help you. Whatever it is that you need, I want to be able to help you for. Your menstrual cycle. A lot of women have a lot of problems with their menstrual cycle, and they kind of say, oh, I thought that was normal, or I didn't really think anything of it. I think it's just going to get better. And I'm like, you don't have to live like that. That is what I'm here to do, is to help you through all of these situations.
Yeah, I think it also bears repeating about screenings as well, and making sure that we're staying on top of our certain screenings. I'm a huge advocate for colon cancer screening since I lost my husband to colon cancer, and especially that disease people don't want to talk about because you're talking about bowel movements. But removing that embarrassment around all things that all bodies do all the time, that we can actually check and make sure that your body is okay, and that these screenings, whether it's a colonoscopy or a mammogram or whatever is appropriate for you, your doctor is here to guide you through it.
I mean, there's only a certain amount of cancers that we have good screening tests for. So I do try to really press upon patients, take advantage of those tests that we have where we can screen for certain cancers a lot earlier, because that is affects the prognosis and there's lifespan. So we definitely want to do those. Our big one is cervical cancer screening and getting pap smears. There are so many women who haven't had a pap smear for many, many years. And I try to tell patients it's once a year. If you're otherwise doing fine, you only have to see me once a year. So it's not something something that you got to keep coming back for. But I think that it can have a great impact on your health care in the future, and just making sure that you stay healthy.
So I actually had, full disclosure, a doctor's appointment this morning, and I wrote down a couple of things that I wanted to make sure I get to, because sometimes I can feel flustered about, oh, I want to get to this, and we've got the regular checkup, but writing things down, is that also a good idea for patients? And are there any other tips that we can do to be prepared for you?
That is an excellent idea, is to write down questions, because sometimes you get nervous and you might forget, or you feel like you're rushing through. So writing down questions, I think, is a great way to remember to bring up those topics that you want to your doctor. Also, even, the week before, or when you make that appointment, start tracking your cycles. Do I have a problem with my cycles? Am I feeling pain? Start thinking back about with your urination or your bowel movements. Am I having issues with this that I need to bring up to my doctor? And maybe even just look at some things online about preventative healthcare screenings, that what I may be bringing up to you, so that you may already have an idea of what we may be talking about at this visit.
It's such valuable information, because again, when we find something early, to be able to treat it, that is the best case scenario.
Exactly. You shouldn't be afraid of that. Technology, medical advances, there are so many new medical advances. And if we can find things early, that makes our job a lot easier.
Dr. Lori Mousy, thank you so much for caring for people the way you do. She is an OBGYN with Corewell Health at Beaumont. Thanks so much again. It's great to see you. Appreciate it.
Thank you for having me.